Hey guys, Kim here, and you are tuned in to Kim E, the Diabetes MP, a place where nurse practitioners can come and learn more about diabetes education and management. Now, today, like I mentioned last week, we're going to talk about diabetes self-management education. What is it and what are the components and how can we implement this in our practice? So, what is diabetes self-management education? Now, you also may see this referred to as DSME. And then you also may hear it referred to as DSMES, which is the S stands for support. And then you may also see a T on there for training as well. But regardless of how you see it, just understand that it is the cornerstone for management of diabetes. Okay. Now, I've said this before, but gone are the days where we just tell patients to just take this medication and then come back and see me. No. Statistics have shown us that we get better patient outcomes when our patients are actually knowledgeable about their diagnosis and that they are able to manage their diagnosis. They're able to make decisions outside of us. We get better patient outcomes. And if you think about it, it really makes sense, okay? It's really common sense, okay? Our patients spend the majority of their time away from us, so they need to know how to self-manage themselves at home, okay? And really what that tells me, like I've said before, is it's a buy-in. When someone is bought into a process, no matter what it is, diabetes, something else, anything outside of medical, when we buy into things, you get better outcomes. Now, by definition, I'm going to read off this definition right here. Now, DSME is the collaborative process through which people with or at risk for diabetes gain the knowledge and skills needed to modify behavior and successfully self-manage the disease and its related conditions. Now, that is what diabetes self-management education is, the process of it. Now, there are times that are critical for this education. Now, over on my Instagram channel, my Instagram platform, which if you're not following me on Instagram, you definitely should. I post daily over there, just quick tips. And one of the things that I do on Tuesday is I do Tuesday tips. Now, Tuesday tips is where I basically answer a rapid fire question. I get tons of questions, and some of those questions just need quick answers. And so that's what I do on Tuesday. They don't need a big YouTube video or anything like that. So I just kind of hop on. It's like 10 minutes or less, and I just answer a question. And over on my Instagram channel, I talked briefly about when you should do diabetes education. And so I thought it would be nice for me to mention it over here as well. Well, there's typically 4 times, critical times that you would want to do DSME. And that would be at diagnosis, when a patient is first diagnosed with diabetes. It should also be done annually. Okay, so every year addressing if any changes have happened, if there are any complicating factors. So if a patient develops a complication, if, that's when you would want to go back and redo your education and just touch base with the patient and make sure that everything is okay and that they understand and clear with everything, educate them on the complicating factor. Also, and lastly, the last thing is transition. So if a patient has a new member, of their medical team, maybe they have a PCP who is retiring and now they're about to have a new PCP, or maybe their endocrinologist is no longer in their network and now they have to get a new endocrinologist. That's a transition. That's an example of a transition. It could be if a patient goes from staying at home to go in and live in an assisted living place, or vice versa. Maybe they leave assisted living and go live with their child, adult child. That is considered a transition. So these were the 4 times that you would definitely want to educate patients. But again, it's also as needed as well. If a patient has a question, you definitely want to educate. If you see that you need to follow up on something, you definitely want to educate. You know what I'm saying? But these are definitely definitely the 4 times where you definitely want to make sure, critical times that you want to be educating and really going back through that process. So what is this process? Well, it's typically this cycle of a process that you just kind of go through, all right? And it starts with assessment. You want to sit down and you want to learn about your patient. What's going on with your patient? What is it on their radar? What is it that you need to know? Do they have anything that you need to address? This is where you would do this with assessment, okay? Then you move into goal setting, which I've made a whole video. I've made multiple videos over goal setting. And so if you haven't checked those out, definitely check those videos out. But after you do your assessment, that's when you would go into goal setting based on what you have learned from your assessment, and you would go in and you would set goals. After you set goals, you would then come up with a plan on how you would go about reaching these goals. So you would go into planning. What is it? How is it that you're going to reach your desired outcome? After you do that, you would then implement your plan. So implementation is the next step of this process. So you go about implementing, and then lastly, you evaluate. Okay, evaluate the whole process. All right. And I want to also say that depending upon the different goals and what's going on, you may not always start at 1 and go all the way through 5. Maybe you have to go back. So maybe you're at goal setting and a patient may mention something and you say, you know what, I didn't pick that up in the assessment. Let me go back and ask some more questions about that. Maybe you're in the planning phase and you realize that, you know what, we may need some more clearer goals. Maybe you'll get to the evaluation phase and say, you know what, I don't believe that this was very clear to the patient. So let's go back to our goals. Let's go back to our plan and make sure that we flesh that out a little bit more. So it's very fluid, but this is considered the diabetes self-management education and support process. You have assessment, you have assessment, you have goal setting, you have planning, implementation, and then evaluation. Okay, guys, that is all I have for you. Again, if you have not checked out the videos that I have made prior to this, I'm going to put them in the description box, and just browse down there. There's lots of different resources that I link down there. Again, if you're not already subscribed to my channel, go ahead and do that and ding that notification bell. And if you're on Instagram, like I said, I'm heavily over there. I do my Tuesday tips every Tuesday. I do them live and then I put them on my IGTV. So definitely follow me over there at the Diabetes MP. I would love to have you over there. Again, you have been sitting here with Kim E, the Diabetes MP, and I'll catch you on the next video. Bye.